Clinical Conversations on the Smart Chiropractor Show. Today, we're going to highlight one of our Axis 2021 presentations. Our Axis event is our online clinically focused event through the Smart Chiropractor. Be on the lookout for details for 2022 coming soon, but we've been taking time each week to look back at Axis 2021. We had a stacked lineup of guests teaching about fantastic topics related to chiropractic practice. And today we have a special guest on remote patient management. For all of you tech savvy docs out there, I know there are plenty. This is something you want to pay attention to. This is where healthcare is going. And we were super fortunate to have Dr. Guy Riekeman come on and discuss what he has been up to in the remote patient management world over the last few years. You're going to hear a lot more about this topic from us and from many others as the months and years continue to unfold. It is a big topic. It's an important topic. And here's Dr. Guy Riekeman touching upon the principles of remote patient management for our Axis 2021 event.
I want to thank you for joining me for my section of the Axis program. I have to tell you, I'm really excited about this program. So much of my lifetime has been spent dealing with chiropractors who have been focused on new patients and PVA and things that have to do with the business aspects of collections, et cetera, in the practice. And so it's refreshing when we have an opportunity to sit down and talk about why we do all of those things, which is really to enhance patient care. So I'd like to share my screen with you and walk through some areas that I think are really important to the future development of our profession. I think that there are things that are occurring at monumental speed at this particular time. And I think that if we pay attention to them in chiropractic, we can be prepared and be able to offer better patient care along the way. Was thinking about a study that I saw that said that in the 1700s, a person was subjected to less information in a lifetime than what they would be subjected to in one issue of the New York Times Sunday edition. And so it pointed out to me along the way that while the world is constantly changing, it's been changing now at a pace that's exponential. And part of that change has been fueled by technology. And part of that change in the field of technology has really been accentuated over the last year and a half with COVID, because this pandemic accelerated everything at just super fast speed. And I hope when we get done with the presentation, this will all make sense and show us that there are some openings that we can take care of and take advantage of that will allow us to provide better patient care along the way. This is one of my favorite photographs. This is from 1949. It was the first computer of modern age computers. It was a 2-year project that started obviously in 1947. This computer could use 20 words and it weighed 30 tons. One of the major problems with computers back then like this, so they took up an entire room, was not only that they used 200 megawatts of hour to be able to run, but more importantly, one of the major dangers was that they started fires frequently because of all the transistors, et cetera. And then this is another character. I keep him front and center in my photo file. This is a man named Michael Cooper. He was the person who did the research on the cell phone at Motorola and was the first person on the planet to make an actual cell phone call. Interestingly enough, a little retribution, he called up the guy at another company that he was competing with to see who could get it out first. So what do these two have in common? Well, we've noticed that computers have changed a lot since 1949. Today, we have a computer that is exponentially bigger than the computer that I showed you from 1949. And yet, rather than taking up a room, it literally resides on a chip and can be strapped to your wrist. And then, of course, you add into this equation the ability to communicate via computers. 1973, Martin Cooper made the first call. In 2007, June 29th, there were people camping out, thousands of them across the world, waiting for the first iPhone to be delivered. They wanted to be right outside the Apple store so that when the store opened, they could be one of the people that got the few phones that were produced, and certainly be able to say at some point, I had the original one. I was one of the first. But, we kind of sometimes think that the iPhones that we use every day are something that has always been around. iPhone's only been around for about 14 years. And what's more important, I have always felt we shouldn't call them iPhones, we should call them iComputers, because being able to call on them is just one of the minor features of the entire apparatus. And then in 1999, Nokia released the first app. It was a app version of the popular game at the time called Snake. And so when you combine computers and phones and apps, all of a sudden you opened up a world that, while some people, especially young people, children especially, live in that kind of world, for some of us, we've watched literally a transformation occur right in front of our eyes. And what this has resulted in the area of healthcare is what we call remote patient management. The ability to manage a patient at a distance using an app in most cases. In this case, I'm going to refer to one that we produced called MLIQ, My Lifestyle IQ. I'm not trying to sell you an app today, but it certainly is a way that I can make some points along the way as we're talking about it. So here's an interesting thing. Carvana, is this company. It has no showrooms. It has a big glass cylinder, and it has cars stacked on top of it. And I had a friend the other day, we were watching a sports program, and at halftime, he ordered a car online, and the car was delivered within 48 hours to his front doorstep. Never met a person, never went into a showroom. Same with Lending Tree. You've seen the commercials, someone sitting around in their underwear on their couch at home, having 5 different mortgage companies compete for their business. Banking has changed dramatically, not only during the course of my lifetime, but it's going to continue to change. By the year 2034, the American Banking Association says there will be no branch banks left anywhere in the United States, not one. Everything will be being done online. White Plains Hospital is indicative of what's going on in the medical world. They have an entire division called Hospital at Home. It's an app, and they're literally in the living rooms, bedrooms, workplaces of over 50% of the people that enter the hospital. There's a medical school that no longer has classes, in-person classes. The entire program is online. They only get together to do the clinical applications. I could continue on with this. You get the idea. Apple Watch has gotten into the world of health now. You can have a complete electrocardiogram while you're on vacation in the Caribbean simply by the watch that's strapped to your arm. So this isn't just about remote patient management. We really have reached a situation where we're doing remote life management to a large degree. But tonight we're talking about healthcare. And so this is what we know about medicine, which, as I said earlier, is in the homes of our patients, in their minds 24/7. 20% of all medical visits last year were telehealth visits. 75% of the hospitals across the United States use RPMs, and 50% of the patients in those hospitals are being placed on RPMs. I mentioned the White Plains Hospital program, Hospital at Home. In 2018, before this accelerated because of COVID, we were already spending $12 billion a year, and 50% of medical doctors were managing patients via some type of app. In 2016, there were 350,000 televisits to medical doctors, and televisits are just one small aspect, a subcategory, if you will, of remote patient management. This year, according to CNBC, there will be 1 billion televisits to healthcare practitioners. Now, you and I both know that the adjustment creates magic in people's lives. We know, for example, that it alters cervical curves sometimes within hours after a patient receiving an adjustment. The work by Scott Rosa and Demazian, who was a Nobel nominee for creating the standing MRI, are doing research on the effects of upper cervical adjustment and how it alters cerebral spinal flow, which also then alters MS and neurodegenerative diseases. Heidi Havik, for example, has shown that when we give an adjustment, the frontal lobe begins to light up like a Christmas tree. So that what we're doing is not just affecting peripheral nerves, we're affecting the basic core structures of the nerve system itself. This is an X-ray. taken from my chiropractor's office. You notice it's a military neck. There's disc degeneration, the lower part of the spine, some lipping and spurring. And here's the post adjustment. By the way, same day, just a few hours after the adjustment was given. Here's another spine, self-explanatory, post adjustment, the same day after the adjustment's given. Now, they may not always be this dramatic, but on the other hand, we know that chiropractic not only alters the function of the spine, but in so doing alters how it's impacting the nervous system. We also know that this has a huge impact in healthcare costs. This is from the state of New Hampshire, where they pay the healthcare cost of their state employees. In 2014, they were spending $7,000 a year per employee. But if that employee was under chiropractic care, not exclusively, not as the gatekeeper, just anywhere in the equation chiropractic care was involved, the cost dropped to $2,000 per person.
All right. That was Dr. Guy Riekeman speaking about remote patient management. I got it out correctly that time at Axis 2021. And he brought up just a variety of fantastic examples of how technology has changed the landscape and or is changing the landscape in so many industries. Healthcare is no exception. We've seen it, the tip of the iceberg with everybody moving from paper to EHRs, but remote patient management is going to be an area of supreme opportunity. And I say opportunity meaning it's a great way to connect with your patients at a deeper level. It's a fantastic way to track their progress and results. Are they reaching the benefits, the goals, the health goals that they had when they came into your practice? And it enables you to document it in the process. So I'm super excited at where this part of the healthcare industry is moving towards. They've made the investment. They've already built some of that IP. So I'm super excited to see what Dr. Reikeman and his team can compile over the coming years. Jason, what are some of your thoughts on it?
You know, I'm just always impressed by Guy's vision for the future and his ability throughout his career to really stay ahead of the curve. He was the one who, literally invented patient education by getting celebrities in the 70s to do VHS videotapes talking about chiropractic care so people could watch them. In fact, the joke back then was that they had to give away the VCR because people would spend $3,000 for the videos without having a VCR at the time. And so they'd include the player with the tapes. This is yet another evolutionary jump. And, his reference to, Lending Tree and the other new digitally based experiences because of the internet is right on. Even, he predicted this, but I'll even go so far as to say now, after the pandemic, it's unanimous that telehealth is here to stay and will continue to grow and basically expand as time goes on. And what Guy's put together is a way for chiropractors to really be a part of that technological revolution. There's rarely the institutional support that modern medicine has to bring these types of profession-wide type programs. That doesn't mean everybody does it. It just means that there's lots of money to create big businesses with lots of doctors participating in these things, primarily pharmaceutical drugs or medical devices. But and chiropractors tend to be more of an individual mom and pop type of a profession. Guy's done an amazing job, and hopefully this will be, an opportunity for thousands of chiropractors to start implementing this type of technology to stay up with consumer demand. And that's really the name of the game. This is not about, oh, I need another widget, or here's another cool way to make a few bucks. It is to be there to meet, I'll dare say exceed patient demand. And that is where we are at between Apple Watches and other biometrics and so on. Having your doctor, as in your chiropractor, be able to help keep you on track to reach your goals is a old concept with a new technology and hopefully a brand new modern application. Kudos to Guy for going for it decade after decade after decade.
I could not agree more. Thank you, Dr. Reikeman, for presenting in Axis 2021. And docs listening and watching, be on the lookout for our announcements coming up regarding Axis 2022.
Hey,
Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.